Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
Suicide thoughts. They have just done a study on 1,000 veterinarians nationally. It came out in October of 2015 in the Veterinary Journal. They actually went in and said suicide thoughts that have gone through your brain thinking that, oh my God, I can't take this anymore, is 1 out of 6 in veterinarians. That is so sad. The second to us is dentists. I don't know why in dentists. I can just tell you why this is in veterinary medicine. We come through a very hard schooling. We are schooled just like a doctor. So we have 8 years of schooling just to be a DVM. And now they're pushing. You have to go on for another 4 years, do an internship, do a residency. So now you're $250,000 in debt from school. You've got a job that only pays you $70,000, $80,000 in a lot of the just general practices unless you become board certified. So you don't get anywhere near to what a medical doctor gets. Then we also are, especially if you're in general practice, if you don't specialize, you are known that veterinarians are supposed to know everything. So it's not like a doctor, you go see your gynecologist, you go see your cardiologist, you go see your internal medicine. Everybody does this. In our field, you go see your family practitioner or your general practitioner. Veterinarian, they've got to know how to do eyes, they've got to know how to do ears, they have to know how to look at the heart, they have to know how to look at skin, they have to know how to do surgery, they have to know everything you're expected, so your expectations are so high and you feel like you're being pulled in 1,000 different directions. And then we have the sadness in our field. It's good in one way to look at euthanasia is a good point, but in the other way, it's sorrow to go through it. I mean, it's hard day in and day out. Everybody always asks me, well, what would you do? Well, that's hard for me to say. Of course, I try to help people through these challenging periods, but it's hard for me to put myself in your place when you don't have the same situation as me. Your money situation, can you afford it? Is this good for your family? But you're always being pulled in that direction. And then you owe so much money, you're living in the poorhouse for 10, 20 years, and people think, oh my goodness, you're making so much money, you're a veterinarian. Well, that's so untrue. And then you're a woman, and you're expected to have a family, and you're expected to take care of kids, and then be in the field and be concentrated on the field, and it's like you got to go home to the family and feed them and take care of them, take care of the children, and then so you are pulled in a million directions. Something has to break in our field.
Banner's a year and a half. I got him when he was 3 months old, so we've been together for a good amount of time. We were out at the land, and we were inside, and it was time to go, so he usually just runs around by himself, so I called him back, and he was laying in the snow, wasn't moving, so went to pick him up, and he was whining, and then I got a little blood on my hands, and figured something bad happened, so took him, rushed him over here quick, blood in the car, he must have bled some more, and brought him in here quick, figured he got shot or something, so took him in here, and they patched him up. He's looking pretty good right now.
So these are the x-rays that we took on Banner the night that he presented to the hospital. And right over here you can see a lot of the buckshot, and the heart is not resting on the chest wall. And this space right here shows what's called pneumothorax. So we have air that got into the thoracic cavity. The doctor who was on that evening was able to take the air off of the chest. So this dog is very lucky to have survived. This is a very serious situation. All of this buckshot that we have remaining, it's questionable to go in and try to retrieve it because of, well, we don't know exactly how deep it is, and what sort of trauma we'd cause by going in. So we are going to do a good strong course of antibiotics and pain medications. Hey, Michael, I'm the doctor on today. You're Travis?
Travis,
So,
yes.
Hey. So, Banner's a very lucky dog. We did sew up the wounds here, and we had to put in some drains. There's one right here, and we have another one right here. You're gonna probably notice that there's a little bit of, it feels almost like air under the skin, kind of like the bubble wrap. Mm-hmm. And that's just gonna take some time to go away. It's probably because of the wounds that he sustained. With the pneumothorax, we know there was a puncture of the tissue, and the gas from the lungs went under the skin.
Yeah.
So that's called subcutaneous emphysema. Okay. We had to stabilize him after the wounds, and we weren't able to do the repair until yesterday once he had been stabilized. Yep. So I know that Dr. Foster went over the x-rays with you. So
that night.
So this is looking good. These are
the little ones?
Yeah, those little ones are, he's got the buckshot's gonna be under the skin.
Nothing serious?
Yeah, we're gonna just put him on antibiotics, leave everything as is for now.
Okay.
Hopefully there will not be an issue with that. I don't know about trying to go in and get all that.
Yeah.
If there might be more harm than good.
Okay.
So he's a very, very lucky dog.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world on our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. PAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. PAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mukwonago, which boasts a fully matted 5,200 square foot training hall. While in Mukwonago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
Leroy boy, we call him. 30-year-old cockatiel that's suddenly for no reason, just started picking on his back. You can see the little lesion on the back there. It's kind of black in color. There was a huge scab on there about a week ago, and he was picking so much that he almost bled to death. And she rushed him in here, and we treated with an antibiotic shot, and then we put that e-collar so he can't get back there to pick. So we're trying to give him antibiotic shots, and luckily we have an antibiotic shot that lasts a week, so the owner doesn't have to give anything at home. And then she comes back weekly until it's completely healed. Now he's a little bit on the crazy side. Come here, Leroy. Leroy boy. Hi, Leroy. Hello, hi. Hi, old man. So we're going to give him a shot right in his breast muscle. He does not like this. I know you don't want to bite me. He says, are you trying to do something? And I'll show you where his lesion is. And usually this is stress related because he looks in such good shape and he's a good weight and healthy in every other way. The reason we have him in this fish tank, we call it, aquarium, is so that he doesn't fall off his perch, because that heavy e-collar on him can make him kind of out of balance. So we send him home with the aquarium to use just temporarily, so that while he's wearing the e-collar, he has to stay in the aquarium.
All right, ladies, here we go.
Leroy.
This is our little Leroy. Yeah, he's doing really well. Yeah.
Oh,
There.
Hi, Leroy.
Good here.
Hello, Leroy. Yeah, you are.
All right, ladies, if you have any questions or concerns when you get home, feel free to give us a call.
All right. Oh, yeah.
And the Osteovet injection, which is the antibiotic that's good for a week. So
that'll help me.
It looks like it's healing.
Thank goodness.
I know that there was a lot of picking and a heavy scab on the back.
Yeah,
okay?
we saw that.
And it's called mutilation in cockatiels, very common. something we think either it's an infection, something stresses them out, like who knows, maybe somebody knocked on your door when you were gone and it got him all, excited and everything, and then they start mutilating and then they just continue. Usually when they pick in the back of their wings or underneath their wings in cockatiels, very common. And it's usually due to a stressful event, like I told you. The only thing that we can do is putting on that e-collar and then using antibiotics to heal it. And then once we take this e-collar off, we're hoping he doesn't go back to it again. There are some birds that I have had that they're fine for a little bit and then they go back and do it again. Then we have to start looking for a reason. Does that make sense?
Yeah.
But one event like this in an older bird like this, I don't think that we need to go any further. We're just giving another antibiotic shot and going out one more week.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I thank Mega and Dr. Dale Crescent for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
There's been a lot of excitement at Haws this year, from newsworthy animal rescues to helping everyday people adopt a new family member. We at Haws know we couldn't do it without the help of people like you. Help us continue our success in fulfilling our animals' needs by donating to the Haws Two-Step Project. By making a general donation and pledging to donate toward our much-needed future expansion, you help us continue the Haws mission of helping animals in need. Log on to hawspets.org and donate today.
Humane Animal Welfare Society.
So Tootie is a 4-year-old, 5-year-old guinea pig. They're not sure of the age. They got it from a rescue. And Tootie's been in here several times for gastric bloat, which is very common in guinea pigs. We have the guinea pig on IV fluids, and we even had a nasogastric tube in at one point to get rid of the bloating situation. And then she becomes okay and moves on her way. They have her on a super good diet. They're very, 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 very good owners that have several guinea pigs that they'll do anything for their guinea pigs. Well, yesterday she presented because she wasn't eating and she had a big mass on the side of her face. When we took x-rays and we poked at it, we found it was an abscess, and I had seen that there was most likely some bad teeth way in the back on the right-hand side. And so we sent her up to Oshkosh, and they went to see the dentist up there, the veterinary dentist, Dr. Crescent, who works at our clinic too, but yesterday he was up in Oshkosh, so they traveled up there, and then they had the dental done there. He extracted the abscess and took out 2 teeth, did a really nice job, and then sent the guinea pig back here for us to treat with pain management and antibiotics and IV fluids overnight. So the guinea pig is feeling much better right now.
Well, I had to bring our little guinea pig Tootie in. She's been here before, just 3 months before we had her in for ovarian cysts. And she had a hard time recovering from that, a big struggle, and she was all better. I was ready to bring her in for showing how good she was doing, and then all of a sudden she wasn't eating. She looked kind of miserable, and discovered that after a few days of being on antibiotics, it wasn't getting better. So we brought her in to our regular vet to get her checked out. She felt a mass on her jaw, which was a bit unexpected. And so then we made the appointment here to get it checked out more thoroughly because she needed to be under some sedation to do that. And that's when Dr. Lichtenberger discovered that it was probably a tooth abscess. So that was, and of course we find out that the dentist is only here on Wednesdays, so that would have been another 5 days, and I just noticed that just in taking care of her over a number of days, she had been declining, getting less energetic, losing weight, and so I didn't think we could wait 5 days. And I suggested, if he's up in Oshkosh, I'm willing to go up today if he's available. And it turned out they were available, and thankfully he was very happy to do it, and I'm very grateful for that. And went up there and got in there and took some, made some aggressive treatment, or some, did the easy thing first, then decided, do we want to go a little further? And I said, my gut feeling is I think we need to go in. And afterwards, Dr. Cresson said, yep, that was the right call. We needed to be in there. So, and luckily, after a little scare bringing her back, when I was dropping her off here at the hospital last night, yeah, she's right in here. Let me take her out. I went to pick her up, and she was completely limp. She had been alert after when I put her in, so I was suddenly scared that she had just died on me in the car. So, but fortunately, she was okay. Probably a little camera shy, but a little purr though. So she's got that little purr. Oh, there we go.
That's a purr.
That's a purr. So that's a good sign, a really good sign. But you can see where they went in on the outside. They had to actually, her mouth was too small to do the work entirely inside, so they had to cut in from the outside to get to the roots. And they said there was a lot of pus in there, and they had to keep flushing it and flushing it. So that was what was causing all her pain. She had a lot of pressure in there, and she just didn't want to eat, didn't want to take critical care, and she was obviously miserable.
She looks very alert.
She's much more alert this morning, or this afternoon.
So let me ask you, when you were bringing her back and she was limp, what was the reason for that?
I'm thinking, well, they told me afterwards that sometimes when they're coming out of anesthesia like that they can sometimes go back and forth. And I had her in the car with the heat turned up, and I was worried that maybe she had been overheated a little bit. So, it could just be that that's normal for coming out of sedation. They can be alert and then all of a sudden be completely out of it again. So I'm hoping that's what it was.
Wonderful. When do you get to take her home?
They're saying I want to keep her another night because, again, she is a little older, and that was a very stressful day for her with early sedation and then the anesthesia later at night. So I think it's probably a good idea to keep her on the IV.
Is there any advice you could give any other owners?
Yeah, that's pay attention to the guinea pigs eating. That's your number one clue that there's a problem. And that's the first thing I noticed. She had a little treat. We have little vitamin C tabs that we give them, and that was her absolute favorite thing. She would drop everything else, carrots, lettuce, whatever. If you came in with a treat, she would go for it. And the first thing I noticed when she wasn't coming out of her pig loo was she didn't even have any interest in it. I'm like, okay, something's wrong. And one other bit of advice with respect to watching how much they're eating is don't overfill the food dishes. I know some people like to just top them off, and then I don't have to put food in once every week or something. Well, then you can't really tell how much they're eating. So I just put a layer on the bottom, so after a day, if they're eating, I see bare spots. And that just, every day I go in to fill it up, I have visual confirmation that they're still eating. Because the sooner you can get them in when they stop, like I said, we discovered this last Friday, so a week ago. It was a long time for her to be in that kind of pain, and I wish. I started treating because she had a respiratory thing going on, and I didn't realize that she had the cyst or the abscess. in the jaw. So if I had brought her in earlier, she might not have been in pain for a couple extra days.
Look at this little guy. Actually, it's a little girl. She's here just to be checked out. Owner's just got her, and nothing cuter than a baby guinea pig. Real sweet. Owners came in today and we're getting them started on the right track with feeding and vitamin C supplementation. So just take a look at that little guy. So today we've got some finches here, and they have, if you look here in this, there's a little egg right down in that basket, and these finches are laying eggs. They just had a clutch of babies and they're old enough, they're eating. The owner brought the 3 birds in. You'll see there's only 2 in the cage right now, and we separated the baby because the parents were picking on the baby. So these parents, now that they've got this egg in the basket, want to protect that, and basically the other baby got booted out of the nest. Just a tiny little guy. In fact, the owner didn't have a name, so we just called him Tiny. And if he flies around, I don't know if you can see, but he's in an area of feather loss due to the parents picking at him. And we are going to empirically treat this little guy for mites, and we will separate the baby from the parents. That's what I told the owner to do. When birds get stressed, they can become infected with mites, and it's usually immune related. So the stress of the parents picking on the baby suppresses the immune system and the baby gets mites. So we're gonna go ahead and treat for mites. Alrighty, so get this little guy out of here. Okay, so we got our little friend here, and you can see this all over the body. He's just got this feather loss. So on the chance that he could have mites, we're just gonna go ahead and treat this little guy. So Chad's gonna go ahead, we're gonna put a drop right over the jugular. And that's it. There, so now he's treated. We're gonna separate this little guy. And that's that.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.